Hi, my name is Nurse Sierra, and I'm going to be taking care of you today, as well as a few other of my coworkers, Nurse Jackie, Nurse Jessica, and Nurse Annika. And we're going to be explaining some things to you as I understand the doctor just diagnosed you with ulcerative colitis. Yeah, I can understand that that's really overwhelming, and we don't really know what that means. So, we're going to offer you some information so you can better prepare to deal with this. Ulcerative colitis is a type of chronic autoimmune inflammatory bowel disease. This disease tends to affect the patient when something triggers an immune reaction, causing the immune system to attack its own GI tract, specifically the colon. Ulcerative colitis often gets confused with Crohn's disease, but the main difference is UC usually only occurs in the colon. Symptoms of UC usually affects teenagers and adults under 30 years old. It can flare back up again in patients around 60 years old. Some of the main factors are genetics, smoking, diet, stress, and pollution. People who suffer from UC usually have a family member who suffers from it as well, or another inflammatory bowel disease. Another risk factor is being Caucasian and of Jewish descent. And it is extremely important for a patient who has ulcerative colitis to stick to their doctor prescribed treatment, as UC puts the patient at risk for developing colon cancer later in life.
I understand being in the ER can be a super scary experience. But I understand that Dr. Smith just diagnosed you with ulcerative colitis. At least now we have a diagnosis for why you've been having so many frequent bouts of diarrhea and so much abdominal pain. The word ulcerative colitis sounds kind of scary, especially when you don't know what it means. So let's explain what ulcerative colitis is. Ulcerative colitis is a form of irritable bowel disease, and it's going to affect your colon or your large intestine and the rectum. Ulcerative colitis is an autoimmune disease. Autoimmune disease means the body is attacking itself. When you have a flare-up, it's called your body's having an inflammatory response. You're going to see the clinical symptoms as fever, abdominal pain, and diarrhea. The large intestine's job or your colon's job is to reabsorb water and solutes. But with the ulcerative colitis and the body attacking its own cells, it makes the colon unable to do that reabsorption, which is why you have diarrhea. With the diarrhea, you're at risk for dehydration. Dehydration makes your blood pressure low. In medical terms, we like to call that orthostatic hypotension. With the low blood pressure, it makes you a fall risk. We want to try to avoid injuries or broken bones that can lead to a surgery. We also have to remember, with your frequent diarrhea, you seem to have an increased amount of blood in your stools. This needs to be monitored closely. You may be able to supplement with iron, or you may need a blood transfusion, but this needs to be continually watched. As your disease progresses, you will likely have a greater urgency every time you have to have a bowel movement. Another complication of the ulcerative colitis is you can get what's called megacolon. Megacolon is when your colon swells and dilates. As the disease process progresses, it goes in 3 stages. The first is the mild stage of the disease, and this is where you're going to have up to 4 semi-soft diarrheas a day. The moderate stage is up to 10 diarrheas a day. Severe stage is you could have 20 diarrheas a day. There is no cure for this disease, but next up we're going to hear from one of my partners, and we're going to talk about medical and surgical management of this disease.
Ulcerative colitis has no known cure, but symptoms can be managed through surgical and pharmacological interventions. Pharmacological interventions are often used to treat the symptoms of ulcerative colitis before surgery is considered and performed. The drugs that are often used are anti-inflammatory drugs, pain medications, dietary supplements, and immune system suppressors. The anti-inflammatory drugs and corticosteroids are often used as one of the first treatments for ulcerative colitis to reduce the inflammation in the colon. Immune system suppressors are used to reduce inflammation in the colon by suppressing the immune system response that triggers the inflammation process. For mild pain related to ulcerative colitis, it is recommended that you take acetaminophen. You should not take ibuprofen because it can irritate the bowels and worsen symptoms. Dietary supplements such as iron are recommended due to the iron anemia that can occur with chronic intestinal bleeding from ulcerative colitis. Other dietary supplements recommended for you are vitamin B, vitamin C, and B vitamins. If your ulcerative colitis worsens, the most common surgical intervention is a proctalcolectomy with ileal pouch anal anastomosis. The surgical procedure is typically done laparoscopically if possible. In this procedure, your colon and rectum are removed, and then the pouch is constructed at the end of the small intestine that will attach to the anus. The surgery preserves the anus and anal sphincter muscles. This surgical option is often preferred by patients because it allows stool to pass through the anus and restores the patient's bowel function. With this procedure, you will have a temporary ileostomy placed for 3 months before the surgeon will do a second surgery to close the ileostomy so the patient is able to pass stool through the anus normally. In some cases, it's not possible to reconnect to the anus, and a permanent ileostoma with an ostomy bag is placed in the abdomen. If you're experiencing an ulcerative colitis flare-up, some people with UC find it helpful to apply gentle heat to their abdomen if they're experiencing cramping or nausea. You should also be taking the prescribed medications to manage your symptoms, such as anti-inflammatories, pain medications, dietary supplements, and immune system suppressors. While it might be tempting or easy to skip medication once you start feeling better, it's important that you don't. Taking all your medications as prescribed helps make sure that UC stays in remission. In fact, not taking medications as prescribed is a major cause of UC flares. It's important to know the foods that are least likely to cause discomfort and the foods that are most likely to cause discomfort. Foods that are recommended include lean proteins such as fish or poultry, cooked vegetables and fruits, yogurt and other fermented foods, avocados and olive oil as sources of healthy fat, and easy to digest starches such as white bread, white rice, traditional pasta, or instant oatmeal. Some foods that you might find best to avoid when you have ulcerative colitis are whole grain bread, crackers, pasta, or cereal, fried foods, dairy products, spicy foods, sweet or sugary foods, and beverages containing alcohol, caffeine, or carbonation. You should also avoid grains, especially those containing gluten. Some people with ulcerative colitis find that getting enough of the right kinds of exercise helps them feel better, possibly by reducing stress and promoting a general sense of well-being. Exercise can also have long-term benefits that may help counteract certain ulcerative colitis complications, such as strengthening your bones and possibly lowering your risk for colorectal cancer. But you need to take certain precautions while exercising when you have UC to make sure that you don't aggravate your condition and to account for any symptoms you're currently experiencing. Here are some tips. Stay close to the bathroom, drink lots of water, don't overexert yourself, and rest during disease flare-ups. If you experience any feelings of anxiety or depression related to your new ulcerative colitis diagnosis, you may benefit from therapy or medical treatment. You can also take steps on your own to combat it, such as set realistic goals taking into account your UC and depression, break larger tasks into smaller ones, spend quality time with friends and family, participate in any activities that you enjoy, and ask for help from friends and family when you need it.
So I know a lot of this information that we're giving you is just very overwhelming, but there's a couple things that are really important that us as nurses, and we could use your help being able to manage this flare up and kind of get you on the road of recovery. Now, one of the big things, probably most important thing, is that we need to keep you hydrated. So we're going to want to have you take in a bunch of fluids, at least 2 liters of water a day. Now, that's about 4 of those big gray cups that we give you at your bedside. So hopefully we can get like 2 in the morning, 2 in the afternoon. We also really need to actually chart your poop. I know it's kind of uncomfortable, but we're going to always be asking you what color it was, what was the consistency, how much, and all of those awkward questions. But we really need to know, because this will also help us be able to monitor what medications are working, what interventions that we're doing are actually working. So we can make a little chart on the wall and we can mark it down, or you can mark it down kind of giving an explanation of how it's working with medications and everything that we do. The third thing is going to be medication compliance. We really need you to be compliant with the medication and just kind of bear with us. Let us know what helps, what doesn't help. Really tell us how you're feeling. You know, we're going to be giving you antibiotics, anti-inflammatories. We're going to be giving you immune suppressors. Most likely going to be giving you fluid and electrolyte replacements. But one of the more important ones also is going to be pain medication. Now, your pain can be controlled with a couple different types of pain medication. We just have to find the right one that works for you. Okay? So prognosis of ulcerative colitis really depends patient to patient. But for the most part, you're going to be able to live a pretty normal life with ulcerative colitis as long as you find a good treatment plan and stick to it and meet up with your care team on a regular basis. Now, if you let some signs and symptoms go, like inflammation or ulcers, and you just let the diarrhea go, it can lead to a lot of different things, like a perforated bowel, malnutrition, anemia, liver dysfunction, and colon cancer. Now, if we are on top of being with our care team a lot and meeting up with them and doing our routine colonoscopies, we can definitely kick the colon cancer in the butt, but there's other things we can treat as well. Now, a lot of people that live with ulcerative colitis on a daily basis. Some people have constant flares up, some just have it once and go into remission forever. You never know. It's case by case. So as long as we stay consistent with the medications, meet up with our care team, do our routine colonoscopies, and really treat our bodies like little golden temples that they are, we should have a good prognosis.
So I know that was a lot of information that you just got from us, but thank you so much for listening. I know that this is a scary time and this is not what you wanted to hear when you came in here today, but patients who have just been diagnosed with ulcerative colitis can feel like they have just been told that they are doomed, but this diagnosis does not mean that you cannot live your life freely. The most important thing is to adhere to the prescribed treatment in order to keep symptoms, inflammation, and attacks at bay. Patient education is very important in order for you to know what is expected in this disease process and when it is time to either call the doctor or even go to the emergency room for something abnormal. Most of the time, the symptoms are manageable with lifestyle change, relief of stress, and medication therapies. You can get back to the activities that you used to enjoy without the fear of ulcerative colitis holding you back. NCLEX question number 1. What differentiates ulcerative colitis from Crohn's disease? Select answers that apply to UC only. Select all that apply. A. Inflammation is usually confined to the colon. B. Weight loss is common and caused by malabsorption. C. Abdominal pain is described mostly as cramping. D. Bloody stool is common. Or E. Increased risk of colorectal cancer. Your answers are A, D, and E. NCLEX question number 2. When is ulcerative colitis considered severe? Select all that apply. A, when mucus and blood are present in stool. B, patient is bradycardic. C, fever is present. D, diarrhea occurs no more than 4 times a day. And or E, abdominal pain is described as cramping. Your answers are A and C. NCLEX question number 3. How can ulcerative colitis be managed at home? Select all that apply. A, reduce stressors. B, exercise. C, rest. D, stool softeners. And or E, personalized nutritional diet. Your answers are A, C, and E.